So today is the lymphatic system of the superior extremity. You know, the lymphatics is nothing but the blood starting from the near the region of the capillaries as a blind lymphatic capillaries, which ultimately join to form the duct known as the lymphatic duct. Lymphatic duct. Lymphatic duct. Ultimate final station of this rail line, of this lymphatic duct, is ultimately in a vein here. I will come later on. So ultimately, again the lymphatic system which collected the extravascular blood near the region of capillaries again go back to the vein, and then to the through the vein, then to the heart. So circulation is completed. Now the question is that in between this lymphatic duct or rail lines, there are stations we call lymph nodes. We call lymph nodes. Multiple lymph nodes are present where the lymph in the vein and artery, which is in the content elements we call the blood, here we call the lymph. The lymph has been filtered and it is scrutinized by the lymphatic system whether there is any foreign particles, any microbial agents, viral, etc. there. If these are there, they try to remove it, and ultimately after filtration, again it goes toward by the lymphatic duct, ultimately join the vein. And these lymphatics which carries the lymph from the tissue towards the lymph node, we call afferent lymphatic vessels. And those lymphatic duct which carry the lymph away from the lymph node centrifugally, we call it efferent. We call efferent. So these are the afferent and efferent. What is the importance of this knowing? Suppose there is an infection here and it is called the draining area. We call it draining area. We call it draining area. Suppose there is an infection in the tissues of this draining area, these lymph nodes will be involved subsequently. Infection, cancer, etc. So examining the enlarged lymph node, when there is an involvement of the lymph nodes are enlarged. We call lymphadenopathy. We call lymphadenopathy. So examining the enlarged lymph nodes, we have got suspicion that something wrong might be there. Maybe benign infection, but maybe dangerous cancer. So suppose in deep-seated tissues, in abdomen, in pelvic region, we cannot examine the primary organs because it is inside the abdomen and pelvic cavity. But if cancer is there, if infection is there, the lymph nodes here will be involved. So by examining it, we can have a suspicion, then ask the patient, then we examine that thoroughly, then ask the patient to do some other investigation to confirm it. Like, so this is important. Now with this introduction, before going to the lymphatic drainage of the superior extremity, you know, these are the lymphatic ducts and these are the lymph nodes, inguinal lymph nodes, axillary lymph nodes, para-aortic lymph nodes, subclavian lymph nodes. So there are so many lymph nodes are there and they have got specific draining area. Lymphatics of the superior extremity, if you want to study, we have to have an idea about the lymph nodes because we cannot examine unless infection is there, the lymphatic duct. But lymph nodes we can examine. So idea of axillary lymph nodes are very important. What are the lymph nodes are present? Important lymph nodes are present in the first and foremost is the axillary lymph nodes. Number one. Number two, They are in the deltopectoral group. Last class I have shown you what is deltopectoral group. In the deltopectoral group, just below the clavicle here, there are some lymph nodes. We call it infraclavicular lymph nodes in deltopectoral group. Number 3, এটা একই infraclavicular and deltopectoral lymph nodes more or less same. Then very important, just above the medial epicondyle here, there are lymph nodes are there known as the epitrochlear or supratrochlear lymph nodes. And some deep lymph nodes are present along the medial side of brachial artery at the bifurcation of the brachial artery. But these are not important. Important are the axillary lymph nodes, infraclavicular lymph nodes, and supratrochlear and epitrochlear lymph nodes. So these are the schematic diagram showing the different lymph nodes. First and most important, and also important for your examination, that is the axillary lymph nodes. Axillary lymph nodes are 20 to 30 in number. As I have told you, when there is a good number, we try to classify. So when there is so many numbers, we want to classify. Yes, we classify the axillary lymph nodes by depending on the position of the nodes in relation to the axilla, axillary boundaries. Whether it is present, these are present in the anterior wall, whether these are present in the posterior wall, whether these are present in the lateral wall, whether it is present in the base, whether present in the apex of the axilla. And usually they are described while during operation, during surgical intervention, we search for the veins. They are described in relation to the, not the artery, but the veins. In relation to the veins. It is posteromedial to this vein. It is close to this vein, such and such. Right? So axillary lymph nodes. These are present in the within the axilla. You know already, you have got idea about the boundaries of the axilla: anterior boundary, posterior boundary, lateral boundary, medial boundary, base and apex. So what are the axillary lymph nodes? Number 20 to 30, situation in the axilla. Drainage area, most important, it not only drains the upper limb, it also drains the breast, majority parts of the breast, and also drain the abdominal wall. So axillary lymph nodes is not the sole drainage area, not the superior extremity. It also breast. So any cancer in the breast, axillary lymph nodes are involved. Any cancer in the skin, here above the umbilicus of the anterior or lateral, anterolateral abdominal wall, axillary lymph nodes are involved. And you have to examine it. So number 1, what are the drainage area? The upper limb, most of the lymphatics of the female breast, and cutaneous lymphatics of the trunk above the umbilicus. So if there is a pathology there in this region, the axillary lymph nodes may be involved. May be, not always. Breast cancer only axillary lymph nodes involved হবে তা নয়. খুব early stage axillary lymph nodes may not be involved. So what are the divisions? What are the classification? Anterior, posterior, lateral, central and apical. Anterior, posterior, lateral, central and apical in relation to the walls of the axilla, boundaries of the axilla. Anterior or pectoral lie in the anterior wall of the axilla along the lateral thoracic vein. This is the axillary vein. This is the axillary vein. And there are 2 tributaries. I have already told you, in case of a artery, we call branches. But in case of a vein, we call tributaries. Don't say branches of the lateral thoracic, a axillary vein, right? You call them tributaries. So tributaries of the axillary vein, there are two important tributaries in the anterior wall of the axilla, is the lateral thoracic vein and another is the subscapular vein. So lateral thoracic vein present in the anterior wall of the axilla. Now description of the anterior, or another name of the anterior axillary nodes, are the pectoral group of lymph nodes. What are the situation? Number one, lie along lateral thoracic vein in the anterior wall of the axilla, just below the lower border of the pectoralis minor muscle, just below the lower border of the pectoralis minor muscle. So when we search for a anterior group of lymph nodes for surgical intervention, cut a nick here, anterior wall, we search the pectoralis minor, lower border of the pectoralis minor, search for the vein, and you will find the nodes. So what is the clinical? There is another clinical anatomy of this anterior axillary nodes. What is that? I will teach you there. This is the breast of the female. The parenchyma of the breast, or main parts of the breast. Skin is removed. Main parts of the breast we call parenchyma. You saw laterally and above, superolaterally, there is an extension, tongue-like extension in the axilla. Breast is situated in the anterior pectoral region of the thorax. But a part of the breast, tongue-like, which is marked by a G, part of the breast goes towards the anterior wall of the axilla. And this part we call axillary tail of Spence. Axillary tail of Spence. So, axillary tail of Spence, when present, not all breast it is present, is in direct contact with these nodes. So, if there is a cancer is there, if there is a cancer is there only in the axillary tail of Spence, or other parts, axillary tail of Spence, there is a carcinoma. So when we examine, suppose there is an, we just somehow reason we examine the axillary nodes anterior wall, you find a swelling there. So you say that it is nothing but a lymph nodes enlargement or infection somewhere in this draining area. So you give antibiotic and ask them to come 15 days after. But actually, it is not the enlargement of the lymph node. It is the enlargement of the axillary tail of Spence, causing swelling. So you are mistaken this thing with the enlarged anterior wall of axillary lymph node. You say, suppose there is an infection there. Oh, these nodes are due to this infection. Okay, I will give this antibiotic and see me after 15 days. But actually it was a cancer. Not the axillary lymph nodes are involved. Axillary tail of Spence are involved, swelling, and you have mistaken this swelling as a lymph node. So whenever there is a swelling of the anterior wall near the lymph node, you must thoroughly examine the breast or ask for the patient to go for mammography. Kalke bolechilam, X-ray of the breast, special X-ray of the breast, mammography. Important. Hobe na, kintu ekta case is, suppose one case you have missed, the patient and or your reputation also. So mind that. So, and also it is important and applied anatomy question. So this is might be a anterior wall lymph nodopathy or might be a cancer of the axillary tail of Spence. So you have to thoroughly examine the area. The draining area key, it is number one. Afferent. Afferent means draining area. So it is the axillary lymph nodes, anterior wall. This is the lymph nodes, anterior wall of the lymph nodes. So what are the afferents? Mean from where it drains the lymph. Number one, most of the breast, most of the parts of the breast, except in the upper and medial part, most of the breast goes to the anterior wall of the lymph nodes. Most of the breast, except in the upper margin and the medial margin. Most of the breast, any infection or cancer of the breast, anterior wall of the axillary lymph nodes involved first. Right? Plus, এখানে লেখা নেই, এটা হচ্ছে 1 নম্বর। Number 2, this is the umbilicus or navel. The cutaneous lymphatics of the anterolateral abdominal wall, cutaneous lymphatics of the anterolateral abdominal wall goes to the anterior group of lymph nodes. So if there is an infection or cancer is there in the skin, these lymph nodes will be, if there is an cancer in there, these lymph nodes will be involved. Not only that help in the diagnosis, it also prognostic value. That's when cancer goes spread, it is not a first stage or 0 stage, it goes to the next stage involving the lymph nodes. So plan of treatment, also the prognosis is different, right? So very important, the examination of the lymph nodes. So these are the afferent. এখানে একটাই লেখা রয়েছে কিন্তু আরেকটা হবে, ক্লিয়ার? এইটা দেখে শুধু ওইটা ছেড়ে দিলে হবে না, যে কোনো কারণে I have missed to writing this. Number 2, efferent. এই lymph nodes থেকে efferent কোথায় যাচ্ছে? Where it goes? It goes mainly to the central group of axillary lymph nodes. Axillary lymph node যাচ্ছে আরেকটা গ্রুপে, central group. From the anterior group, the lymphatics then filtered in the central. From the central, it goes to the apical group of lymph nodes. So when the cancer goes more and more time, it initially involved the axillary, anterior group, then involved the central group, and last involved the apical group. So if the apical group is involved, prognosis is more bad. Right? তাহলে anterior group টা সেরে গেল। Posterior or subscapular group. This is the posterior wall of the axilla. So posterior group present in the posterior wall of the axilla along the subscapular vessels. Along the subscapular vessel. This is the posterior group. This is the subscapular vessel. It is anterior. This is the posterior wall. This is the subscapular vessel draining into the axillary vein. The posterior group lie along the posterior wall of the axilla, along the subscapular vessel. Mainly vein. To artery. Afferent. এইটাখানে কি বলেছিলাম? ট্রাঙ্কসের anterolateral wall above the umbilicus. A posterior wall cutaneous so posterior wall, a posterior group of lymph nodes drain the cutaneous lymphatics of the posterior wall of the trunk up to the iliac crest. Iliac crest opor theke ei jagataকে বলে iliac crest বা umbilicus এর লেভেলে যদি যাও একই ব্যাপার। So above the umbilical level or above the umbilicus case, এইখানে তুমি হাত দাও এখানে, there is an bony part, it is called the iliac crest. So above the iliac crest, the lymphatics, cutaneous lymphatics of the skin and subcutaneous tissue, it goes to the posterior wall of the lymph nodes. These are the afferent. Efferent, again central group of lymph nodes. From the central, it goes to the apical group of lymph nodes. Easy. Next, lateral group, very important group, lie along the lateral wall of the axilla. Cone vessel, axillary vein, posteromedial to the axillary vein, posteromedial to the axillary vein. This is the axillary vein, posteromedial to the axillary vein. এই জায়গাটা ফিল করতে হবে, এই যে এরম ভাবে lateral wall, this is the lateral wall. So posteromedial to the axillary vein, very very important lymph nodes for the superior extremity. Afferent from the entire upper limb except those accompanying the cephalic vein. Entire upper limb except the lateral part, mean thumb and index finger. Hear me properly. All of the lymphatics of the upper limb enter the lateral group of lymph nodes, except this patch of area, thumb, index finger, means lateral side. Then the lateral part of the hand, lateral part of the forearm, lateral part of the arm. That means that part which accompanying the cephalic vein. Ei je cephalic vein in the lateral wall. So lateral group drain the medial three fingers, index, little finger, ring finger and middle finger. The medial part of the hand, medial part of the forearm and medial part of the arm, which goes to the lateral group of lymph nodes. Efferent, again central group. So anterior group of lymph nodes receive the lymph, lateral group receive the lymph, posterior group receive the lymph from the draining area, ultimately sets it into the central group. What is the now central group? Central group situated close to the base of the axilla. This is the base, the skin, axillary fascia, এই যে হাত দিলে যেটা হচ্ছে, it is the base of the axilla. So it is situated in the base of the axilla, embedded in fat. One important applied anatomy question, very important. Intercostobrachial nerve passing through the central group of lymph nodes. If it is a central group of lymph nodes, it is a central group of lymph nodes situated close to the base of the axilla, central group, a nerve, a branch of the second intercostal nerve passing through this central group of lymph nodes, through the central group of lymph nodes. So, and this intercostobrachial nerve supply the medial side of the arm, এই জায়গাটা intercostobrachial nerve supply the medial side of the arm. That's mean it is a sensory nerve. It carries pain, temperature sensation from the medial side of the arm. If it is irritated, if you stimulate by anything, electrical, etc., there will be pain in the medial side of the arm. So what's happened? If these central group of lymph nodes are enlarged, because central group of lymph nodes will be enlarged due to many regions, from the breast, from the superior extremity, medial side, right, from the anterolateral abdominal wall, posterior abdominal wall, all the area ultimately drain into the central group. So ultimately central group also involved. Central group is enlarged and it presses this nerve. It makes a pressure on this nerve, causing irritation of this nerve. Pressure korche. So there will be a pain in the patient complain of ei jagata ekta tingling some numbness ba pain hocche ba tingling numbness hocche. Come on. So a patient come with you. So doctor, there is a pain in here. You must examine the axillary lymph nodes. Then back calculation, if you found there is an axillary lymph nodes are involved, then you will search for the draining area, breast, abdominal wall, etc. So this is the important, right? So afferent from the anterior, posterior and lateral group of axillary lymph nodes, and efferent ultimately agei bolechi all goes to the apical group of lymph nodes. Next, apical group of lymph nodes, where it is situated. Look, this is the intercostobrachial nerve supplying the medial side of the arm, and here it is situated the central group. So if there is an enlargement, it irritates this nerve, causing pain in the medial side of the arm, constant pain, irritation, etc. This is the intercostobrachial nerve coming in the upper limb from the second intercostal space. It is the lateral cutaneous branch of the second intercostal nerve. It will come on thorax. Dissection খুব সুন্দর বেরিয়ে apical group situated at the apex of the axilla, medial to the axillary vein, afferent subcutaneous lymphatics from the upper limb, from the lateral side of the hand, forearm, arm and thumb and index finger. আগে বলেছিলাম কি lateral group, which part of the superior extremity is in drain? The medial side. Medial 3 fingers, medial side of the hand, medial side of the forearm, medial side of the arm goes to the lateral group, except this area. তাহলে ওগুলো তো যেতে হবে. Where does they go? Here, to the apical group. So if there is an cancer there, or if there is an infection there, apical group will be involved first. Sometimes infraclavicular group will be involved. I will come later on. So the draining area of this lateral side of the superior extremity, including the thumb, index finger, lateral side of the hand, lateral side of the forearm, lateral side of the arm, accompanying the those parts which accompanying the cephalic vein, ultimately drain into the apical group of lymph nodes. There is some interception in the infraclavicular group. I will come later. The upper margin of the, আমি বলেছিলাম আপার মার্জিনটা বাদ দিয়েছিলাম, দেখো this upper margin of the area of the breast goes directly to the apical group of lymph nodes. Arekta ki? All other group of axillary lymph nodes, means all other groups drain into the central, and from the central it goes to the apical. So ultimately apical group of lymph nodes will be involved. It is the final. Next, efferent. এইবার এখান থেকে it goes to the vein. From the apical group of lymph nodes, the efferent starts. And in the here in the neck, এটা neck area, the axillary vein ultimately it from the subclavian vein. জানো তো? হ্যাঁ, এটা কি vein? এইখানে venicomittentis of the ulnar, venicomittentis of the radial, join to form venicomittentis of the brachial vein. This brachial vein continued as the axillary vein. Axillary vein here continued as a subclavian vein. Just when it crosses the outer border of the first rib, the name is changed. We then call it, this is the outer border of the first rib, call it the subclavian vein. The subclavian vein joins with a vein from the head neck, known as internal jugular vein. Very important vein. Brain and other parts of head neck drains here. And ultimately, it forms a vein known as the brachiocephalic vein. Two brachiocephalic vein then joins together to form the superior vena cava, and superior vena cava goes to the right atrium of the heart. So, these are the apical group in the axilla. This ultimately drain into the vein, the junction of the subclavian and internal jugular vein. This is the subclavian vein, this is the internal jugular vein, joined to form the brachiocephalic vein, right? Left side is straight high. So, from the apical group, anterior group, posterior group, lateral group, central group, all goes to the central group. From the central goes to the apical group, and from the upper margin goes to the apical group, and apical group ultimately drain into the vein at the junction of the subclavian and internal jugular vein. Sometimes joins with the right lymphatic duct or thoracic duct. It will come later on. সময় চলে যাবে. And a few lymphatics of the apical group drain into the, some lymph nodes are present in the head neck, we call the cervical lymph nodes. Few lymphatics, few of the apical group joins with the lymph nodes. But the most important is the A. Mostly drains at the junction of the subclavian and internal jugular vein. So if there is an question about the axillary lymph nodes, you will write in paragraph introduction, number 20 to 30 number, how the classification done in relation to axillary, then the classification apical, anterior, posterior, lateral, central. Then you one by one describe apical, situation, afferent, efferent. Anterior, first start from anterior, anterior, situation, anterior wall of the axilla, the lower border of the pectoralis minor, along the lateral thoracic vein, afferent, efferent, then lateral, then posterior, in this way, ultimately apical, and ultimately efferent drain. শেষ হয়ে গেল কি? No. You have to write the applied part. Applied part already I have described. any any infection or carcinoma present in the draining area, these groups are involved. And these groups not only help in the diagnosis, staging of the carcinoma, but also important for treatment and treatment protocol. Number 2, axillary tail of Spencer applied anatomy. Number 3, intercostobrachial nerve applied anatomy, what I have told, এটা গেল applied. Next, তাও শেষ হলো না, এটা schematic diagram, apical, anterior, posterior. আচ্ছা, very important. এবার তুমি যদি সার্জিক্যাল ডিপার্টমেন্টে যাও, সার্জারি ডিপার্টমেন্ট কিচ্ছু মানবে না, what are telling anterior, posterior? They only know level 1, level 2, level 3. Because this is important, but actually it depends upon the anatomical classification. The most key feature of this surgical classification is most key feature of the classification is the pectoralis minor muscle. Key feature of this surgical classification is the pectoralis minor muscle, because some anterior group lie below the lower border of the pectoralis minor muscle, lateral group তাই, posterior group তাই, central group lie এরকম, কেমন, আর apical group lie here. It is the pectoralis minor muscle. ভালো করে দেখো, এটা খুব কঠিন না সার্জিক্যাল ক্লাসিফিকেশন. It is the lower border, it is the upper border. The anterior group, posterior group, lateral group lie below the lower border of the pectoralis minor muscle. Central group lie behind the pectoralis minor muscle, and apical group lies above the pectoralis minor muscle. So, surgeon call it which loads lie below the pectoralis minor, level 1. Level 1, which lies behind the pectoralis minor, central, level 2, and apical, level 3 lymph nodes. কোথাও দেখবে না ডিসচার্জ সার্টিফিকেটে লেখা রয়েছে যে the lymph nodes axillary, anterior, posterior, lateral, বলে level 1 lymph nodes are involved, removed. So level 1 is the anterior, posterior, lateral. Level 2 is the central, level 3 is the apical. So here the prognosis is good, intermediate, bad. কারণ level 1 এ মানে কি, জাস্ট ব্রেস্ট ইনভলভ হয়েছে, এটা মানে কি অলরেডি টাইম পাস্ট, ক্যান্সার স্প্রেড, আর এটা তো আরো ডেঞ্জারাস। So it is a surgical classification, level 1, level 2, level 3. এবার লিম্ফ্যাটিক, আচ্ছা, প্রিভিয়াসলি ব্রেস্ট কার্সিনোমার ট্রিটমেন্ট ছিল, if not a initial stage, remove all the lymph nodes as a whole in block dissection of the axillary lymph nodes, all the lymph nodes, central, apical, lateral, apical, সব, and it is removable because this group of lymph nodes remain in a, it is covered by a fascial tent, like fascial tent, একটা তাঁবুর মধ্যে যেন lymph nodes রয়েছে. So dissection is very easy and they remove all of the lymph nodes. Nowadays it is not, surgeons not prefer even in advanced cases to remove all the lymph nodes, because sometimes on removing the lymph nodes damage of the axillary vein, damage of the intercostobrachial nerve, etc. may occur. Plus, on long-term study, it has been found those which involve the axillary and other lymph nodes already spread to other regions, no need to spread it. So, surgeon nowadays do modified radical dissection or simple, with all the lymph nodes with structures around it, part of axillary vein, etc. removed, we call radical dissection along with the whole of the breast. We call radical dissection of the breast. Nowadays it is not advocated. Nowadays it is done only part of the breast where the cancer with the surrounding healthy tissue margin with a minimum removal of the lymph nodes. Mainly level 1, maximum level 2. And try to make the breast as normal as possible. We call BCS or breast conservative surgery. Is form of plastic surgery. Chede dao, what I tell might be wrong. Now, if there is a short notes of the without axillary lymph nodes, there is a long question there, and make a tail of the question, describe the lymphatics of the superior extremity. Then you will write the lymphatics of the superior extremity is divided into superficial lymphatics and a deep lymphatics. Superficial lymphatics and a deep lymphatics. They all start, like the vein, dorsal venous arch. Similarly, lymphatics capillaries form a network in the dorsum of the hand, dorsal lymphatic network, and palmar, and also lymphatic network in the palm also. But ultimately palmar network of lymphatics goes to the dorsal network. And like the vein, dorsal network, some of the lymphatics accompanying the basilic vein, some of the lymphatics accompanying the cephalic vein. Now tell me, those lymphatics which accompanying the basilic vein, kon finger? Though lymphatic ducts which accompanying the basilic vein, kon finger in drain korbe? Huh? Medial or lateral? Huh? ভালো করে জোরে বলো। বেসিলিক ভেন ড্রেন করবে, ও বললো ল্যাটারাল। হ্যাঁ, তুমি তো ল্যাটারাল বললে। বেসিলিক ভেন কোন সাইডে থাকে? In which side of the forearm the basilic vein is present? Medial or lateral? Lateral? Medial. তাহলে কোন ফিঙ্গার ড্রেন করবে? Medial 3 fingers. Medial 3 fingers, medial side of the hand, medial side of the forearm, medial side of the arm. কোথায় যাবে? Which group? Basilic vein along the medial side of the arm, forearm will drain into the lateral group of lymph nodes. But while doing so, এইবারে ভালো করে শোনো। It is the medial side, it is the lateral side. So, the lymphatics along the medial side of the arm, which accompanying the basilic vein, first drain into a lymph nodes just above the medial epicondyle. We call it epitrochlear or supratrochlear lymph nodes. Then, from these epitrochlear lymph nodes, drain into the lateral group of lymph nodes. Epitrochlear or supraclavicular lymph nodes. Then it goes to the lateral group of lymph nodes. So, any cancer in the skin or medial three fingers first involved here. So, you must examine the lymph nodes here. And the lateral side of the hand, thumb and index finger, initially infraclavicular lymph nodes, and ultimately apical group of lymph nodes. It is a borderline and it accompanies the cephalic vein. So medial side accompanying the basilic vein, lateral side accompanying the cephalic vein. First, they have a small station, intermediate station, infraclavicular lymph nodes in the deltopectoral group, then to the apical group of lymph nodes. But ultimately, these also go to the central group, then to the apical group. So these are the lymphatic drainage of the superior extremity, involve epitrochlear lymph nodes enlargement. তাহলে পরীক্ষায় কি লিখবে? এরকম ভাবে লিখবে। Starts as a subcutaneous lymphatic plexus, one on dorsum of the hand, other in the palm. Dorsal and palmar digital plexus joins the dorsal plexus. Lymphatics general of both plexus accompanying the cephalic and basilic veins according to the side. The vessel draining the medial three fingers and medial side of the hand and forearm follow the basilic vein, then drain into the supratrochlear lymph nodes, then into the lateral group of axillary lymph nodes. এইটা যদি থাকে জীবনে ভুল হবে না এই ফ্লো ফিঙ্গারটা। Are lymphatics from the thumb of the index finger and lateral side of the hand and forearm pass along the cephalic vein and drain first into the infraclavicular lymph nodes, then into the apical group of axillary lymph nodes. Deep lymphatics, এটা গেল superficial. Deep lymphatics which is usually accompanying the artery and ultimately drain into the lateral group of axillary lymph nodes. These are the section to remove the lymph node. This is an axillary lymph node involvement. This is another lateral group of lymph nodes enlargement. So embryology is the branch of science which deals with the development of fertilization till the development of the mature development. We call it embryology. It starts from the fertilization, then to the different stages of development. Ultimately, it forms the mature fetus and baby is born. Not only that, after birth also, some development also going on. So this is, so ultimately embryology is a branch of science that deals with the study of formation and development of an organism. We are also an organism. Cow is an organism. Reptile is an organism. We are also an organism. Total development, adult, we call it embryology. So embryology does not mean only before birth. It may occur after birth also, brain development. It may occur after birth also. And there are two terms, ontogeny and phylogeny. Ontogeny is a branch of science that deals with the complete life cycle. Complete life cycle. Fertilization, zygote to adult development. তাকে আমরা বলি ontogeny. আর phylogeny মানে কি? এই যে আমরা বাদর থেকে মানুষ হয়েছি, এই যে প্রসেস অফ ইভলিউশন তাকে আমরা ফাইলোজেনি বলি। কেমন? যাকে এগুলি বেশি ইম্পর্টেন্ট দরকার নেই, দরকার নেই, এইটা ইম্পর্টেন্ট। পিরিয়ড অফ হিউম্যান এমব্রিওলজি ছেড়ে দিচ্ছি। There are three stages of the human embryology: germinal period, embryonic period, and fetal period. Till birth, there is in three phases. Germinal period, first 3 weeks of development. We start fertilization day 1, then day 2, day 3, day 4, day 5, day 6, day 7, first week. Day 8, second week start. Day 9, second week start. Similarly, so up to 21 days, it is the germinal period. From 22 days, 3 weeks হয়ে গেল, তার মানে 21. From 4th to 8th week of development, তাহলে 3 weeks হচ্ছে জার্মিনাল পিরিয়ড, আর 4 weeks থেকে 8 weeks তাকে বলি এমব্রায়োনিক পিরিয়ড, and 8 weeks থেকে টার্মিনেশন অফ প্রেগনেন্সি known as the fetal period.